Good afternoon. I'm Dr. Angrist. I'm a wellness expert, chiropractor. Been in practice in New York and New Jersey for 39 years. As a matter of fact, tomorrow, October 19th, is my 39th year anniversary. I started October 19th, 1979 in an office on 58th Street and Lexington Avenue with another chiropractor as an associate doctor, and over 39 years basically have evolved into a practice of understanding wellness and rather than strict chiropractic. I was trained as a chiropractor to treat pain, and that's what this webinar is about, Pain Management 101. I was trained to treat pain by simply making an adjustment to the spine. But that wasn't enough for me. It was basically, I had asked the question many times, why is a person having pain? Not what is the pain and what can we do to just mechanically fix it or medically take a medication or pill to fix it, but really understanding the why behind it. And that's what this webinar will be about. This is our second in a series of webinars. Last month we talked about finding your calm, which is really, you can go back. If you don't have it, certainly contact us, contact Chris. Finding your calm is really the essence of what I deal with managing pain or just managing life, having an inner peace, a calmness to really get your body to function, to work the way it's supposed to. So let's get into this. If you have any questions, certainly don't hesitate to ask us. You can take notes on any of this. We have the notes for you if you need, but certainly I'm going to wing it and discuss this with you, and hopefully it will help you be more aware, make better choices, natural choices about your health and your well-being. So that's what this is about. There are many options out there. Generally, there are three options when it comes to pain. Medications are one, surgery is another, and therapy. So basically, I come from a therapeutic perspective. So that's the choice. Sometimes drugs are necessary. Sometimes surgery is necessary. But it's about, again, you being an educated healthcare consumer and making the best choice you can for you. Nobody else is going to look out for you as much as you. So let's start with understanding pain. What is pain? It's a symptom. And we're in a society that we tend to suppress symptoms, whatever they might be. But as a chiropractor, I deal mostly with pain, back pain, neck pain, headaches, shoulder pain, foot pain, things like that. So if you just suppress the pain and say, okay, this is what I have is pain, and let's suppress it, even with a treatment, even with a medication, I don't feel you're really getting to the root of the problem. And the pain is what it is. The real question, as I said previously, is why is it? Why am I having the pain? And I always talk about the sequence of events that cause pain. The sequence of events that cause pain are this thing we all have in our lives called stress. You have it, I have it. It depends on what kind of stress we have, what combination of stressors we have in our lives. So we have physical stress. So we sit at a desk or a computer. We're maybe a little bit overweight or a lot overweight. Maybe our posture's poor. Maybe our sleep habits are poor. Those are physical stressors to the body. Then we have emotional stressors, work, school, relationships, finances, time management. Those stressors can wreak havoc on the body. And then there are chemical stressors, eating processed foods, sugars, sodas, caffeine, alcohol, things like that. Foods in boxes, foods in cans that have all kinds of labels. So it's basically all of those stresses bombard us in our life. And it's a matter of what does that stress do? Physical, chemical, and or emotional stress. It causes constriction. We don't get more relaxed when we're under stress. We get tighter when we're under stress. So when our body tightens up, it means our muscles are tightening up. We contract, we compress, we constrict. And what happens when that happens? It constricts our nerve. So if my finger's a nerve, my hand's the muscle. Muscles protect the nerve. So if my hand is relaxed, there's no pressure on that nerve. My hand's tight, the muscle's tight, it literally strangles the nerve. And that's what happens. That's why the sequence of events of what causes pain is it starts with stress. 9 out of 10 people that come to me in pain and I ask this specific question to them, what did you do? What physically did you do to create your pain? And they'll say, I didn't do anything. You didn't do anything different. You didn't lift anything. You didn't work out differently. You didn't fall. No, I didn't do anything physically. Because 90% of pain comes from stress in our lives. So it's not about the physical. Pain has to come from a physical source. It can come from a physical, an emotional, and or a chemical, nutritional source. And that's what I try to explain for people to understand, that it's much bigger than just the pain, okay? So hopefully you have a good idea of what pain is. It's a symptom, it's an end result. It's almost like on your car, on the dashboard of your car, there's a flashing red light. So you can keep driving with that, but eventually, if you don't get that checked, your car's going to break down. So you've got to make sure that you understand what the cause is. The cause is that red light. Something's going on in the engine. You can't just cover up that red light on the dashboard. You can't just cover up the symptom, but yet that's what we tend to do in our society. Just cover up the symptoms. It's a signal. It's your body telling you something. Even if you don't know, there's always a cause. The problem is we don't always know what the cause is. Can't always be clear about it. But when we start being more introspective about ourselves, being more in touch with ourselves, we can find out, is it something physically that's going on in my life, emotionally it's going on in my life, or nutritionally going on in my life, or a combination of those. Even thermally, the changes in temperature, humidity, weather certainly have an effect on our body. So it's being aware of all of that. But the bottom line is to become as resilient as we can be, emotionally, spiritually, and physically, to deal with all of this. So we're going to talk about all this today. Types of pain. Basically, there are two types of pain. There's acute pain and chronic pain. Acute pain is somebody that has pain from 1 day to, say, 3 to 6 months. Short term, for whatever the reasons are. It could be physical, but it could also be something emotional, nutritional, as I described. And then there's chronic pain. People have had pain for long periods of time, over 6 months. And it depends on how that's managed. And people many times are taking, especially in our society today, are taking opioids and other medications, powerful medications. That medication does what it's supposed to. The problem with medications are the side effects. So again, you as an educated healthcare consumer have to be really aware of what the potential side effects of medications are, and therefore deal with that. And then there are other methods, either drugs, like I said, surgery, or therapy. There are options, okay? So acute pain, chronic pain. Even there's a research, not a research, but there were some recommendations. I just want to read this to you. It's called Choosing Wisely. The goal of Choosing Wisely campaign is to promote conversations between doctors and their patients about utilizing the most appropriate tests and treatments. The campaign is an initiative of the American Board of Internal Medicine Foundation and Consumer Reports, not Chiropractic. And it says, in the absence of red flags, do not obtain spinal imaging x-rays for patients with acute lower back pain during the 6 weeks after the onset of pain. So they're saying, don't take x-rays. Trust that the body is going to heal, either on its own or with the appropriate therapies or even medications. So I think that's very important, because when I first started in practice, I'd send everybody out for x-rays and MRIs. And I'd find out, okay, so somebody has some disc involvement or some nerve involvement or some arthritic involvement. So what does that mean? Does that mean you need surgery? Does that mean you're dying? No. But many times we need to give the body a chance to heal. And if the body heals, there's no need for all of those inappropriate tests. Now, if the chronic problem is chronic, then certainly we need to take a look and see what's going on there. But even then, what are the choices regarding the therapy, drug, surgery, or therapy? Okay, so really understanding chronic pain, acute pain, and you being very involved in your life. Nobody's going to care more than you do about your own health. So you really got to become more educated, more aware, more in tune. Pain in the brain. So pain is a nerve symptom. The brain and your nervous system are connected. It's one. It controls every aspect of your body. You moving your fingers controls control from the brain. Your digestive system producing enzymes to break down food is produced by the brain. The heart beats because of your brain functioning. It's subconscious. We don't have to think about it. So nerve pain is very important in understanding what's the difference between nerve situations and symptoms versus muscular or soft tissue symptoms. So symptoms like pain, numbness, tingling, burning, cold, weakness, those are neurological, brain-type symptoms that affect the nervous system, as compared to symptoms that many times people have that come to me: tightness, stiffness, soreness, achiness. Those are muscular, soft tissue symptoms. Much better to have those symptoms than the ones I previously mentioned. So it's about differentiating. But the thing is, many times when somebody has pain, they also have tightness, stiffness, soreness, and achiness that associate with it. So they're intertwined. The nervous system and the muscles and the joints and the discs in our body actually all work together. One affects the other. So it's a matter of really differentiating: is your problem a soft tissue problem, or is your problem a neurological problem? And that's what we try to do and find out with regard to evaluations and the types of treatments we provide and the type of symptoms that you have. But certainly your brain has a major effect on the rest of your functioning of your nervous system and of your entire body. So we're going to talk about that further. Common causes of chronic pain. Well, again, doesn't have to just be that you had a physical trauma. Somebody could have a physical trauma in their life, and ever since that physical trauma, they've continued to have pain. No question about it. But we have to look at the physical, chemical, and emotional causes of what's going on. What can you clean up? Are you overweight? Then you need to lose weight. Are you not exercising enough? You have to start exercising. Is your posture poor? Have your posture improve. If you're not eating as well as you should, start eating better. Those are the things. Emotionally, how am I dealing with my job situation, my financial situation? How you deal with that will help you with your chronic pain. So rather than looking outside, look within you. Matter of fact, I always say, when you point your finger like this, there's three fingers. When you point to blame something or use something on the outside as the answer, there's three fingers pointing back at you. So always look within. As I said, being introspective is an important part of healing, and the emotional part is the main engine that drives this. Chronic pain treatments. So we're going to go through some treatments. I'm a chiropractor, so chiropractic care is one of them. And there are many different tools to use. And chiropractic, the word chiropractic, practic means practiced by, kairos means by hand, practiced by hand. And it's a manual therapy in order to what? Reduce muscle spasm, restore flexibility, which ultimately reduces pain. That's what I call, what can we do to help you be fab, F-A-B, fabulous. Restore flexibility, alignment, and balance. And if we can help you restore flexibility, alignment, and balance to your spine and your musculature, and even emotionally, then you're going to, chances are, have less pain. So that's your goal. However you do it, even if you don't come to me, what can you do to restore flexibility? You can take a yoga class. You can stretch. You can have better posture, which helps with the alignment and balance. You can do specific exercises to restore balance. You can do core strengthening exercises. So there are definite things that you can do, and we'll talk about that also today. It will help you in balancing your life, which therefore, in turn, helps reduce pain. So as I said earlier, it's not just about treating the pain. It's about treating you. I always like to say, I treat the whole system, not the symptoms. So people come to me with the symptom, but yet, how can we treat you? How can you treat you as a whole being, as a whole system, which you are, emotionally, physically, spiritually, and chemically. Electrical stim is another component. It's a form of physiotherapy, and electrical stim, muscle stim, nerve stim, stimulates blood flow and nerve flow to promote healing, to reduce muscle spasm. It's another tool. How many tools do you have in your toolkit to build your house of health? So chiropractic care, electrical stim is another one. Massage, we do soft tissue trigger point therapy to release the tension in the muscles. As I said earlier, due to the stresses of life, do our muscles get more relaxed or do they get tighter? Get more tense, more tight, more taut. Poor diet even has an effect on how your muscles react with regard to nutritionally. If We're eating foods that have lots of chemicals in them, processed foods, McDonald's and Burger King, sodas and French fries and all that. It builds up what's called lactic acid in the muscle. And the more lactic acid you have in the muscle, the tighter the muscles get. So our goal is to restore flexibility, and massage, the stim, chiropractic, those are tools to help that. Acupuncture, another great tool. Acupuncture simply means the puncturing of the skin to open up energy in the body. So we use more acupressure, we use our hands in therapies to open up energy. They use acupuncturists use needles, but it's about energy. The reality is, in our body, when we have all of the stress, we have this contraction, it actually blocks energy. So the metaphor would be, if there's a river, visualize a river flowing, and in that river flowing, it's vital, it's energized. And then we put a dam to block that river. What happens? It now becomes stagnant. Well, the same thing happens in our body. And that's what an acupuncturist looks for. That's what we look for, those blockages. And they put the needles there. I use my hands to find those areas of blockage or interference to open up that energy, open up that chi, as acupuncturists call it. And that's what life is about. Even regarding, you want to be around people that have great energy rather than no energy or negative energy. Energy is key to health and wellness. Foods, some foods have energy. Fruits and vegetables and fish and water versus foods that have dead energy or no energy. Processed foods and sugars and cakes and candies, you get a temporary boost, but it's fake energy, okay? So basically, acupuncture, another excellent tool. Most important tool, and there are many others, but the most important tool, because this is about you, is self-management, responsibility. The word responsibility, ability, the ability to respond. How do you respond to the pain? So the pain is not the problem. It's what you do about the pain that's the key issue. So remember, it's not, oh, I've got the pain. Why do I have the pain? What am I going to do about the pain? So self-management is so vital. What do you do at home? What's your posture like? What's your sleeping habits like? What's your nutrition like? What's your exercise like? And what's your mindset like? Those 5 keys. Those are the 5 keys to health. And if you can really handle, manage those, that's how you start to get healthy and well. So it's not about, again, covering up or masking. It's about expressing, really being aware. Just even good posture is about expressing yourself, being more open rather than shut down, close down, okay? Understanding some aspects other than pain. So with pain comes sometimes emotional issues, depression, can have pain, acute pain or chronic pain, being frustrated about the pain. It can create compensation because of pain. Other parts of your body react to that pain. So for example, people will come in with a left hip problem, and 2 weeks later they'll say, you know, my left hip is bothering me, but now my right foot started bothering me. Because what happens is your body shifts. It adapts to that pain. So it has to take away some of that pressure so other parts of your body react to that, okay? It can affect your productivity pain at work or at home, your happiness, your sleep. So it's not just about the pain. So you want to deal with your life, your lifestyle. And that ultimately will allow you not only to have less pain, but to enjoy your life that much more, to be more flexible, to let more stuff go, not to be so caught up and so uptight. Life is way too short. We might as well enjoy it. Live in the moment. And it's just an imperative part of health and healing. And people say, what does that have to do with my pain? I'll say everything. You know, it's just a matter of understanding the past is history, the future is a mystery, and the present is a gift. That's why it's called the present. So live in the present, live in the moment. Do as many right things as you can. Are you perfect? Absolutely not. Am I perfect? Absolutely not. It's not about being perfect. It's about trying to be outstanding. It's trying to be excellent as best we can in our lives, making the best choices. We all go off track. It doesn't matter. It's about getting back on track. It's about not having patterns of bad habits. It's about having patterns, interrupting patterns of bad habits. So when you have bad habits, as we all do, whether it be emotionally, physically, or nutritionally, how do you get back on track? And that's up to you to decipher and decide. Some self-management techniques. effective pacing. So pacing to me just is being consistent. How consistent are you with your exercise, with doing planks, with stretching on a daily basis, with being conscious on a consistent basis of good posture? You have good pacing when it comes to brushing your teeth. We all do that every single day. Well, why don't we do that with other aspects of our life, with regarding exercise and regarding nutrition and regarding attitude? How consistent can you be? Okay? And then we get back to food choices. I always talk about eating the colors of the rainbow: red, orange, yellow, green, blue, indigo, violet. Roy G. Biv, if we remember from science classes. So eating colors that are red. What's red? Tomatoes, apples, watermelon, oranges, yellow, bananas, and so on. The greens are so vital. The Brussels sprouts, the broccoli, all that imperative to good health. But yet a lot of people don't like that stuff. And I can't force anybody to do that. So it takes supplements that might have that in it. But it's certainly so important to you having less pain in the long run. And again, that connection between my food and my pain, when you start to cleanse your body, when you start to nourish your body with healthy foods, your body functions at a higher level. And therefore, when your body functions at a higher level, you have less pain. When your body functions at a lower level, your body tends to have more pain. Of course, physical activity. I always say motion affects emotion. So motion affects your emotional state. When you move, your emotional state is higher. When you don't move, you don't exercise, your emotional state is lower, commonly called anxiety or depression. So we need to move. Even if you're not going to a gym, walk every single day. Make sure you take 10,000 steps a day. Just move so your body flows. You're aware of your posture, okay? Because emotional pain is probably even more severe than physical pain. We have a major epidemic with emotional pain in our society. And I know in my heart, based on 39 years of doing this, that the physical body, if the physical body's working better, it can only help the emotional component. But yet 70% of our society is overweight or obese. 7 out of 10 people. Kind of tells me 7 out of 10 people aren't exercising or working out. Of the other 30%, I'm not convinced that they're all working out. So many people are not exercising and having physical activity. So no matter what you're doing, start with baby steps. Start walking. Make sure you walk. Instead of taking the subway or the taxi or whatever it might be, start walking. And then you can build into doing other things. There's 3 categories of exercise. There's stretching, there's strengthening, and there's cardio. And those are the only 3 categories every exercise can fit into. Some combination of those. So I always recommend starting with stretching, flexibility, and then getting into cardio, making sure you're moving, and then strengthening. Sometimes strengthening, especially with too much weights, can create a problem. And the reason for that is we have all this tension to begin with, as we talked about, in the muscles, which means those muscles are tight. And then you start exercising with weights, and then you actually contract those muscles even further. So therefore, when we do weights, you have to be really careful about the amount of weight, your age, what you're capable, how much you've been doing in the past. It can wreak havoc for the physical body. Easing stress and tension emotionally, it's a photo of just meditating. And the meditative component of life, most people don't meditate, aren't aware, are afraid, don't understand how to meditate well. But it's just getting your mind, and that's what we talked about in our last webinar, is creating and finding your calm, that tranquility, that peace. Because we live in a world of turbulence. Turbulence outside in the news, what's going on in this world, it's pretty crazy. So how can you find inner peace and calm? And meditation is one of the key components. For patients of mine, you understand that when you're on the table and we use that electrical stim, we use the hot packs, I call that the meditative component of the treatment, just to relax your mind and your body. It's not just your physical body, it's your mind. The mind-body connection, so important. Sleep. Most people don't get enough sleep. 7 to 9 hours is recommended by the researchers. Anything below 7, anything above 9, they have direct correlations to illnesses and diseases. So try to make sure. I know it's hard sometimes. Many people will say, I only get 5 hours. If you can get a nap in, try to get that 7-hour number if you can. Really, really important. Sleep heals. If you ever had a cold or flu and you don't sleep, you're coughing, you're sneezing, a couple of nights, finally, third, fourth night, you have a good night's sleep. How do you feel the next day? Feel better. We need to sleep. It is so important. Get to bed earlier, get up earlier, but everybody has their different cycles. It's New York City, and a lot of people go to bed very late, they eat very late, but it's about balance. Life is about balance, and you get to balance out your life. Focus. What do we focus on? So do we focus on the light, the goodness in our lives, or do we focus on the dark? Okay? It's your choice. We all have light, and we all have dark. Even if light is 90% and dark is 10, we tend to focus on that 10%. How do you learn to focus on the light? All the good that you have in your life. Do we focus on the light or the heavy? Same thing, the heavy stuff. Well, that heavy stuff is heavy, physically, emotionally heavy and physically heavy. And that's why poor posture occurs, because we can't carry around all of the weight, that heaviness for long. Over 50, 60, 70 years, eventually the body says, I give. I can't handle it anymore. So learn to focus on the light in your life, the love, the kindness, the giving, the caring, all the good stuff, because we all have good stuff, and we all have some bad stuff. But where do you elect to look? We all have shadows. When the sun is out, we have the sunshine, but there are shadows beside us. So it's okay. Doesn't matter. It's about acceptance. That's what good posture. I accept, I allow, I give, rather than fighting everything. The heaviness, as I said, of where our mind goes. Positive thoughts, as I've said, your mindset, the more loving, caring, giving, and kind you are, the less stress there is in your body, the less tension there is in your body. In that example I gave you before of the muscles strangling on the nerve, it eases, it opens up. So basically, it's a matter of letting that go with positive, loving, kind thoughts. Ergonomics. So most of us, we sit at a desk or we're on a computer and we have posture issues. So that is so vital also. What's your posture like? I call it, as Tony Robbins calls it, state management. Managing your state. Is your state here, proud, or is your state down? I'm down. Again, that heavy weight on our shoulders, being on the computer, text neck as I call it, being on the text, on the phone, and being hunched. Well, that leads to, whatever age you are, down the road, the potential for having poor posture. So ergonomics, the way we sit, the way we stand, the way we walk, the way we sleep, all of that, proper ergonomics, just about being conscious. How conscious can you be about posture, about sleep, about exercise, about nutrition, about your mindset, raising the bar? And we say sometimes kids, young kids aren't conscious, but as we get older, we should be conscious. Well, that's my challenge to you is, as an adult, be really conscious about yourself, about your habits, about your choices, about being healthy and well. And then this is a chart we give to patients about how to sit properly. If you need this, certainly be happy to send this to you. Just contact us. But it gives you the different angles, eye levels, angles of your feet, of your arms, to take the pressure off of your body. So how we stand, our mindset, exercise, little things that make a big difference. And when it comes to pain, everything I'm talking about are the precursors to pain. Rather than pain, okay, I have pain. It's what you do about it. And hopefully, by going through this, gives you a lot of information about what you need to do, who you need to be. So it's always about what to do, but I'm a big believer in who are we? Who am I as a human being? There's an expression, be, do, have. Who you be, who you are as a human being, what your beliefs are, plus what you do, what your action steps are, then determine what you have. So again, we want to always take the action, which is good, but remember who you are. Are you loving, caring, giving, and kind? Or are you judgmental, critical, negative, analytical of everything that's going on? Let things go. Allow. Be aware, be in touch with your own body. Use a natural approach, at least first, that's the option, and then go from there. I thank you for taking the time today. I hope you've learned a lot. If you have any questions, we're going to be doing future seminars, webinars. Next ones might be on subjects such as managing arthritis, insomnia, sugar, many different topics. If you have any ideas on what you'd like to hear about, be happy to talk about it. And I thank you so much. Have a great day. Bye-bye.